When people faced the relentless mechanized warfare in the trenches of World War I, medicine was suddenly forced to find solutions for grievous injuries of various types and in overwhelming numbers. As this was even before the advent of antibiotics, the medicine of the time encountered extraordinary challenges. Constant bombardment with various projectiles, machine gun fire, corrosive chemical weapons, and even horrific burns caused in many ways led to injuries on a scale the world had never seen before. It was during this time that plastic surgery fought to restore both the appearance and function of destroyed tissues of unfortunate soldiers. In this video, we will show you the history of plastic surgery and prosthetics and how they have evolved to the present day. Soldiers returning from the front were often traumatized and disfigured, known as broken faces. It is estimated that 40% of French soldiers were rendered disabled, and 14% of the wounded were facially disfigured. Old photographs show many war veterans being pushed in wheelchairs by their comrades or hobbling along with the aid of prosthetic limbs, crutches, and walking sticks. There were also many blind men tapping their way with their white canes. Many soldiers were so horribly disfigured that they even referred to themselves as broken gargoyles. While many of the limbless ex-servicemen could disguise their disabilities, the facially disfigured faced a far more conspicuous and unforgiving return to civilian life. Missing noses, ears, mouths, and jaws, some simply withdrew from normal life, abandoning parents, wives, and children, while many of them were dependent for tube or spoon feeding. Their stories are deeply moving and often tragic. Attempts to create prosthetic body parts date back to as early as 3,000 years ago in ancient Egypt, with examples like a prosthetic toe or even some reconstructive surgeries. Throughout the Middle Ages, some progress was also seen in such operations as scientists realized the importance of hygiene and clean wounds, which increased the success of their procedures. However, as medicine gradually advanced, some wounds that were certainly fatal could now be survived. Yet, it was often the question, what next? Medicine had advanced enough to save a soldier's life, but not enough to allow him a relatively normal life after partial recovery. Then, with the advent of World War I and industrialized warfare, the injuries sustained from new and widely used devastating weapons were simply horrific and in vast numbers. Millions were killed and tens of millions wounded, and doctors, who had been more or less accustomed to treating gunshot and bayonet wounds, were now literally shocked and overwhelmed. However, besides numerous amputations and horrific injuries, a large number of soldiers sustained dreadful facial wounds. In trench warfare, the lower parts of the body were mostly protected, but the face and head were highly exposed to the risk of shrapnel and gunfire. At the beginning of the war, such facial wounds were, to say the least, not treated properly. Surgeons would try to stitch the wounds and piece the torn skin together, which completely destroyed the normal facial line, leaving eyes, noses, and jaws nearly lost. Imagine waking up after such an injury and surgery, seeing the horror in the mirror that is now your new face. Beyond the initial shock, you now think about what your wife, family, and friends will say when they see you, and where is there any life or job after the war? Then came Harold Gillies, a surgeon from New Zealand, who, after witnessing these horrors firsthand on so many soldiers, decided to take action. In Britain, he established a special unit to deal with these wounds, which eventually grew into a Queen's hospital, where new special techniques for treating these injuries were developed. One of the most successful procedures involved using a piece of healthy skin, called a pedicle, from the patient's own body. This piece of skin, still attached to its original location, would be moved to cover the wound or damaged area of the face. By keeping the skin connected to its original blood supply, doctors increased the chances that the body would accept the new skin without problems. These processes took several painful months and numerous surgeries, but gave severely wounded soldiers a chance at a somewhat improved appearance, compared to just stitching the wound and essentially losing their entire face. As for limbs, before the war, prosthetic replacements were extremely expensive and inaccessible, mainly designed to improve appearance rather than function. The challenge was to create joints and fingers and find a way to control and use them in practice. An Italian orthopedic doctor named Giuliano Vanetti came up with a solution called a motive lap. The idea was to use the remaining muscle and skin on the amputee's stump to move and control the prosthetic limb. In 1915, about 10 years after Vanetti's initial work, a German surgeon named Ferdinand Sauerbruch improved this method. The success of this approach depended on how much muscle and skin were left after the amputation. Other prosthetic solutions came in the form of masks for soldiers who had sustained facial injuries. British sculptor Francis Derwent-Wood developed such masks, realizing that his talent could be useful to these unfortunate soldiers. He set up a unit to create masks, usually made from tin or copper. Each mask started with a plaster cast of the patient's face. Wood would use the cast to figure out how to rebuild the missing parts of the face. After shaping the metal and completing the restorative work, he would paint a portrait on the mask to match the patient's skin tone, creating a smooth transition. Wood's work inspired other artists, such as American sculptor Anna Coleman Lad, who contacted Wood, and together they refined the process. Lad's masks were considered more realistic, and she traveled to Paris to set up her own workshop to make masks. She often included human hair to recreate eyebrows or mustaches, while masks were usually attached to a person's face using glasses. She made around 180 such masks, but approximately 20,000 soldiers did not have the opportunity to at least slightly hide the traces of war on their faces. At first, these men were seen as heroes, showcasing the immense sacrifice they made for their country. However, after the war, these horrific faces of the poor soldiers reminded people of the war they were trying to forget, and they were often viewed as others, different, and even less valuable. Many struggled to reintegrate into society after the war, find jobs, partners, and live normal lives. Reconnecting with their families was difficult, and they were often pushed aside far from the public eye, irreversibly changed. The horrific injuries from World War I significantly impacted medicine, particularly in plastic surgery and prosthetics. The urgent need to treat disfigured soldiers led to rapid advancements in surgical techniques and the development of innovative prosthetic devices. As World War II approached, these advancements were further refined. The introduction of antibiotics reduced infection rates, improving surgical outcomes. Rehabilitation centers became more specialized, focusing on the physical and psychological recovery of injured soldiers. These innovations ensured that medical professionals were better prepared to handle the complex injuries of the Second World War, ultimately saving countless lives and improving the quality of post-war recovery for veterans. These men deserve to be remembered and given the respect they earned, not just for their sacrifices during the war, but for the even greater sacrifices they made after the war in what should have been a normal civilian life, but was anything but.